concerned about getting the right health care for your aging parent or your aging loved one, with the ever increasing population of our aging adults, it's really time to, make a move to more considerate approach with our aging population, especially with our healthcare system. So, in this video, I'm going to be breaking down what is an aging friendly healthcare system. How do you find them? What makes them different from any other healthcare system? So stay tuned. We're going to get all those questions answered for you today in Tuesday Tips. Hi, my name is Pam Dunwald. I am one of your nurse advocates from Your Nurse Advocate Consulting. And every week we come with Tuesday Tips on a different topic around speaking out in the care of your aging parents or an aging loved one. And so we're excited to bring this topic tonight. According to the U.S. Census Bureau, the U.S. population aged 65 years of age and older is expected to nearly double over the next 30 years. So we're right now about 43.1 million in 2012 to go to an estimated 83.7 billion by the year 2050. So with these demographics and the advancements, even though they're really extraordinary, they've left our healthcare system behind in many ways because now the greatest population that we're serving are aging adults, and they need different types of care. So we're going to talk about tonight, what is a reliable aging friendly healthcare system look like? Where can you find them? And so before we get started, I just want to put the recognition where the recognition belongs. So Age-Friendly Healthcare Systems is an initiative of the John A. Hartford Foundation, the Institute of Healthcare Improvement, or IHI, in partnership with the American Hospital Association and the Catholic Health Association in the United States. And this initiative's been around for a while, and they actually have a certification that hospitals, clinics, all types of healthcare systems and entities can become a certified age-friendly facility. So with Your Nurse Advocates Consulting, we have adopted the aging friendly, or the 4Ms concept, into our practice, so that we're making sure that when working with our seniors, which we do, we work with aging adults and their adult children and their families. So it's really important for us to be on top of this and to be current with this age-friendly initiative. So we're going to get into that. And so the first step that we're going to do is we need to talk about what is, the aging-friendly concept. So the aging-friendly concept is based on looking at our aging client or our aging patient with what they call the 4Ms. And we're going to be spending the month of October really delving into each one of these 4Ms and what does that look like when it comes to providing care according to the aging friendly guidelines. So the 4Ms, we've got medication, mentation, mobility, and what matters most. So we start with what matters most, and that is what matters most to the patient and their caregiver. I'll give you an example. My mother-in-law is dealing with some health challenges. I've been to the clinic, I don't know how many times with her, being her nurse, being her daughter-in-law. My husband is on, and his sister is on her power of attorney. Many times we've told the clinic, please allow me to be able to discuss her healthcare issues with everyone. Please put me on the list, do whatever we need to do that. And so I don't know how many times we've had to do it. We just went to the doctor this past week, and we had to do it all over again. And with the healthy aging, or the aging friendly initiative, the focus is not just talking to that aging adult, but to talk to the caregivers. Who are the main people? Who are their support people? I can tell you, my mother-in-law is 89 years old. We're sitting in the doctor's office, and the doctor's telling her, about tests and the thoracentesis, have a needle put in your side to take off fluid. She's not understanding any of this. And I just cringe at how many of our aging adults are going to the doctor's office, and by the time they're done being talked to, they've got this deer in the headlight look because they really don't understand. So even in our hospital, we are requiring that when a patient is discharged from the hospital, we identify their support person up front, whether it's a family member, a friend, however that is their choice. we involve them in the planning of the care, and they're also made aware ahead of time that they are supposed to be there present with the discharge instructions. So we are giving discharge instructions, talking about medication changes, all the different things that they need to do when they go home, that they are there present so that there is a support person, someone who can understand, who can support them, because they're going to have trouble. Even, I'll give you an example. One way that with teaching with adults is we use a teach back method. And what is that? Well, if I tell you for your congestive heart failure, the number one thing that you can do above all anything else is get into a habit of weighing yourself every day. Get a scale in your bathroom when you wake up in the morning, use the restroom, have a pad of paper there, write down your weight every day. Same thing. Just keep that in a routine. And then if you gain 2 pounds overnight or 5 pounds, in 1 week, that's your trigger to call the doctor. Don't wait for your ankles to get so swollen. Don't wait for you to get short of breath. So I was teaching a patient this, and I asked, we went over all those, what I just said, like 3-4 times. So I said, well, what can you tell me about weighing yourself? Well, weigh every day. Good. Very good. And what do you remember? What about when should you call the doctor? And she's like, 2 pounds? I said, yeah, 2 pounds, but how, over what period of time? I don't know. She couldn't remember the 5 pounds. And this was after spending a half an hour. And this isn't an alert aging adult. So my point is that when you're considering aging adults, take it to the next step. Make sure you're involving that caregiver. It's not just about the patient. We have to involve the people that are caring for them so they're well informed, so that they can know how to take care of them. So that's, kind of an example. So with the 4Ms, what matters most is meeting them where they're at. What do they want? What are their healthcare goals? Not what we're telling them they should be, that you should do this, you should do that. That's all fine and good once we find out what their goals are. And medication. So many times elderly people are overprescribed. They've got medicines from 4 or 5 different doctors. They've got a laundry list, a box full, of pill bottles. And sometimes, those pills interact with each other. You have one pill to take side effects for this, and it causes this. So one of the philosophies of healthy aging is to have that physician actually look at an aging person's medication list and say, you know what, they're on a boatload of medications. Let's gradually see if we can wean them off of some of these medications and get it down to a reasonable level, so that so that we can see what's going on. If someone has dementia, we say M for mentation or cognition. When we're looking at dementia, the healthcare system or facility should have access to a gerontologist. A gerontologist is a physician who specializes in geriatric medicine or medicine for seniors, the aging population. They are a great resource for managing dementia. There are some medications that they can use to help slow that down or manage any behaviors or symptoms they may be having. That person would be the expert when you're looking at how to manage, or a geriatric neurologist, a doctor specializing in neuro issues with the aging population. So having these specialists available is another step in the direction of having or being an age-friendly facility. So those are the mobility is the last M that we talk about. So, a lot of us, as we age, we develop issues with being able to walk, being able to do activities of daily living, getting around. We may need a walker. We may sometimes advance to the fact that we may need a scooter. So, is the doctor recognizing these changes? Are they recommending physical therapy? Are they using the best form of equipment that they should? There's several types of walkers and other assistive devices, is to use in the shower, used for bathing. So physical therapy and occupational therapy, how often are they recommending? Are they asking you about your mobility? Are they asking your loved one about how are you getting around? What can we do to make that better? Many times, elderly people have dizziness. Well, or, do they need to be evaluated for what we call vestibular, or the reason for dizziness? There's crystals in your ears that if they get out of whack, they're going to cause dizziness. Well, physical therapy can put you through a series of exercises to get those crystals back in place, so it alleviates the dizziness, the nausea, the spinning. So there's lots of things. So how, when we're looking at an age-friendly healthcare system, how, what are they doing to address these four M's? What are they doing to look at that senior and looking at their age, and what can we do to improve their lifestyle? All right, let's change slides here. So one of the other things that we're looking at within an age-friendly system, we talked about, conversations that should take place in multiple points: annual visits, major life events, changes in health status. Just always updating, because we know as we age, our our health changes, and it's always changing. The older we get, the more it changes. So how are they staying on top of that? Are they re-asking the questions again? Because 6 months ago or a year before, if you had your checkup, a lot of things could have changed in that amount of time. So it's very important that they're reviewing these assessment, or these four M's, on an ongoing basis. Aligning care to each patient is still kind of a relatively new concept. So, many of you may not have heard of this. What we're going to do is, we promised, and we'll get to that in a minute, of how you can find some age-friendly facilities or systems in your area. So it's essential to note that selecting an age-friendly healthcare system can have a significant impact on the quality of care that your loved one receives. And ensuring the right care that's provided in these four M's areas, with regularly assessing them and the mental health, they can help prevent cognitive decline by staying on top of these things. So really, really very important. Key considerations. We just want to look at that a little bit when we're looking at an age-friendly facility. How easy is it for our aging person to maneuver, get around in the hospital? Is there a information desk close by? Is there someone there to direct them? I can think of one facility in our area. They have a valet service. So if someone has mobility challenges, they can pull up to the front of the hospital. The valet person will park their car, and they have another person around too. If they need help out of the car, they have wheelchairs right there. They can wheel you in. And so they really, really provide this service to be able to accommodate our seniors that have mobility challenges. Again, make sure that we're looking for facilities that have geriatric specialists. Consider, again, the accessibility. Where is everything located? Are they going to have to wander around, or can they just get into the hospital, and right there front and center is an information desk that's there to help them? So also look maybe at the system's policy. So for example, or ask questions. Everyone is allowed to interview a provider. They will make appointments just for interviewing your provider to see if you feel that they are a good fit. Don't hesitate to do that. Be an educated consumer, for yourself and for your loved one. Ask them what's their philosophy on ordering opioid, pain medications. A lot of elderly people have chronic pain. What are their treatment plans? What do they do to help those elderly? Or are they, prescribing, a lot of narcotics or opioid medications? Again, the aging population is very sensitive to them. I mean, it may take a narcotic for us to relieve a certain kind of pain if we fractured something in an elderly. A Tylenol or an ibuprofen, depending on what the doctor recommends, may be enough without having to go to these heavy medications that keep them confused, and they get delirium. They don't know where they are, and a lot of things can happen with medications. So we want to kind of ask them their philosophy. What do you do anything special? Do you treat your aging patients any differently than you treat your other population? And if they say no, there's a red flag for you. That's a very simple question to ask. If they can't give you any kind of concrete differences in how they consider treatment for seniors in our aging population, there is a red flag for you. Okay, so let's move on. And here's, again, a couple of examples that I made note of. So does the healthcare system have geriatric specialists? We talked about that. Are there transportation services available for seniors who cannot drive? Some nursing home facilities, they actually provide their own transportation. So if we're discharging someone from the hospital, they actually have their transportation. They will come and pick up the patient. Now, some of them will charge, or that will be on the bill, but they try and provide the transportation because they will have, handicap accessible, transportation available. Are there any emphasis on preventative care and wellness programs for aging adults? That's a big thing. That's a big proactive thing. So what are they doing? Like senior sneakers is like a senior exercise program. What are they doing? What do they have going on in their healthcare system to accommodate those seniors with exercise or wellness programs that are appropriate for their age and their abilities? So making the decision. So consider the healthcare provider's experience with geriatric accessibility, communication. Who are they talking with? Are they always just talking to the patient? Are they kind of not including the family member or the caregiver? That's a red flag. And how are they coordinating with other specialists? So are they bringing in those geriatric specialists if they feel a need? So these are some tips to take into consideration. So, in choosing a aging-friendly healthcare system, it's crucial to ensure the best care of your aging loved one. So, what we're going to do is this video is being recorded. I know we're live in our forum, so I encourage everyone to check us out. We have a private Facebook forum, and it's speaking out on the care of aging speaking out on the care of your aging parents. So feel free to stop by. We have tips, strategies, discussions. We have Fun Fact Fridays. We have Frustration Fridays. We have Wellness Wednesdays. We have all kinds of things geared towards helping you care for your aging loved one, and also give you a platform to ask questions, get answers from us, and get some really good discussions going. So we will have this there. We're going to record this. This will be available. And in the description, I've got a couple of links for you that I will share. How do you find an aging facility in your area? And one of the links is for a list of current age-friendly certified facilities throughout the country. So you'll be able to look and get an idea. And be curious to see if any of your healthcare systems are listed on that. And I'm going to check and see if ours is as well. So hope you've enjoyed this conversation. Check back. We'll be back next week. Think about, consider getting in the forum. We'd love to have you there and work with your situations there. So we will see you soon. Take care.